Hello, Namaste. I'm Dr. Amit. So today we'll quickly revise autonomic receptors, a very high topic of pharmacology, in just a couple of minutes.
So let's have a quick revise from this picture. Okay, so as we all know that in our body we have two nervous system. One is autonomic nervous system and one is somatic nervous system. So this autonomic nervous system is that nervous system which works automatically and is not under in our conscious control, and the somatic nervous system is that system which control the voluntary movements like moving your hands, moving your legs. So that is somatic nervous system. Now, this autonomic nervous system is further divided into parasympathetic and sympathetic nervous system. So, as we all know that parasympathetic nervous system is for rest and digest system, and the sympathetic nervous system is for flight and fight system. Now, let's talk first about this parasympathetic nervous system. Okay, so while focusing on this parasympathetic nervous system, so as we all know that this parasympathetic nervous system originates from brain stem and sacral spinal cord. Okay, so that is parasympathetic nervous system start from brain stem, that's cranial nerves 3, 7, 9 and 10, and from sacral spinal cord, that is S2, S3 and S4. So from this figure we can see that this in parasympathetic nervous system, from brain stem a neuron is originating. Okay, so this is called as preganglion neuron, which is long and it is ending over this is called ganglion. Okay, so this preganglionic nervous system is releasing ACH, a neurotransmitter in the ganglion, and this ACH is received by, this is called NN, that is nicotinic neuronal receptor. So this NN receptor is nothing, it's simply a protein which is receiving the ACH which is given from the preganglionic neuron. Okay, now from this ganglion, okay, so ganglion is nothing, simply it's a place in nervous system where the preganglionic and the postganglionic neurons meet. Okay, so from this ganglion the postganglionic neuron starts and it reaches the target organs. Okay, and in target organs it gives ACH, and this ACH is then received by the muscarinic receptors, either M1, M2 or M3. Okay, so these cholinergic receptors are present in smooth muscles, gland cells, nerve terminals and cardiac muscles, and over there after getting when ACH get attached to these receptors, they produces parasympathetic effect in those organs. Okay, so just for a quick recap, parasympathetic nervous system start from brain stem and sacral spinal cord. Okay, so just think that preganglionic neuron is simply a bus. So a bus is coming over here, it stop over a station called ganglion, and over here it just some of the passengers called ACS comes out of the bus and they get to another bus called postganglionic neuron, and this postganglionic neuron comes to the target organ where it releases ACH, and these ACH get bind to the M1, M2 or M3 receptors in the target organs, and over there it produces parasympathetic effect. Now let's talk about sympathetic nervous system. Okay, so as I have previously told you that this parasympathetic nervous system start from brain stem and sacral spinal cord. So this sympathetic nervous system start from the spinal cord. Okay, so in spinal cord, from where? From the thoracolumbar outflow, that is from T1 to L2. Okay, so now in sympathetic nervous system there is also a preganglionic neuron. Okay, so there is a marked difference between sympathetic and parasympathetic, that in case of parasympathetic nervous system the preganglion is longer and the postganglion is short, but in case of sympathetic nervous system the preganglion is small and the postganglion is long. Okay, nice. Now this preganglionic neuron start from the spinal cord and it ends in ganglion. As we all know, the ganglion is nothing, it's a place where the preganglion end and the postganglion start. Now in the ganglion there is a receptor called NN receptor. So this nicotinic neuronal receptor is nothing but it's a protein and it receives the ACH. So in the ganglion it receives the ACH. Okay, now from here a postganglionic neuron starts and it releases norepinephrine. So in case of parasympathetic, postganglionic neuron release ACH, but in case of sympathetic nervous system it releases norepinephrine. Okay, now this norepinephrine binds to the adrenergic receptors. So as we all know that adrenergic receptors are the receptors of sympathetic nervous system. Okay, and muscarinic receptors are the receptors of parasympathetic nervous system. So when this norepinephrine binds to these adrenergic receptors called alpha 1, alpha 2, beta 1 or beta 2, it produces sympathetic actions. Okay, where in the smooth muscles, gland cells, nerve terminals or cardiac muscles. But there are some exceptions. Okay, like in case of renal vasculatures, okay, the blood vessels of kidney, the postganglionic neurons release dopamine. Okay, so dopamine act on the alpha 1, alpha 2, beta 1 and D1 receptors where it produces vasodilations. But there is a two marked difference, okay, from where most of the MCQs comes. Okay, that sweat gland is first. That, as we all know, that the sympathetic nervous system postganglionic neurons releases norepinephrine, but in case of this sweat gland, the postganglionic neuron releases ACH, and ACH is generally released by what? Parasympathetic nervous system. But here, as sweat gland is part of sympathetic nervous system, but it still produces ACH, and this ACH bind to M3 receptor on the sweat gland. Okay, so sometimes the MCQ will be asked like, in sympathetic nervous system, in which organ, okay, or in which part ACH is released by postganglion? In sweat gland. Okay, and the second difference is in the adrenal gland. As we all know that there is a preganglionic and it releases ganglion, then a postganglion starts and it releases again the norepinephrine or dopamine and it reaches the target organs. But in case of adrenal gland, there is no postganglionic neurons. The preganglionic neuron directly innervate the adrenal gland, and these adrenal glands are directly activated by these preganglionic neurons, and the adrenal gland release catecholamines in the blood like epinephrine and norepinephrine, almost 80% epinephrine and norepinephrine, and this epinephrine now goes to the target organs and works on the alpha 1, alpha 2, beta 1, beta 2 adrenergic receptors and produces sympathetic effect. Okay, so this is about parasympathetic and sympathetic nervous system. Now we'll have a quick revision on somatic nervous system. Now, while talking about this somatic nervous system, as we all know, the somatic nervous system is under our control. Like we can raise our hand, we can raise our leg, so it's under our control. So this somatic nervous system also starts from the spinal cord. Okay, now from spinal cord, it has a nerve called voluntary motor nerve. Okay, it doesn't have a preganglionic or postganglionic nerve. It's called voluntary motor nerve, and this voluntary nerve, motor nerve reaches over here. Okay, and this is called as NM receptor. Okay, this is called neuromuscular junctions. Okay, so over this neuromuscular junctions, it releases ACH and it will work on the skeletal muscles and produces a voluntary effect. Okay, so for a quick revision, parasympathetic nervous system start from brainstem. Okay, and it releases ACH over in the ganglion also, in the postganglion also. But in case of sympathetic nervous system, it releases ACH in the preganglion but norepinephrine in the postganglion. But there are two exceptions. That one is sweat gland, where it releases ACH in postganglion also, which is very important for you from MCQ points of view. And the second one is in adrenal gland. It's a part of sympathetic nervous system, but there is no postganglionic neuron in case of here. It detect the preganglionic directly innervates the adrenal gland. Okay, and the third one is somatic nervous system, which starts from the spinal cord and it reaches the neuromuscular junctions and it produces voluntary effect.
So this is all about a quick review of this autonomic receptors. In the next video, we'll talk about cholinergic receptors and adrenergic receptors one by one in details and how the drugs work on these receptors. So if you like this video, please subscribe my YouTube channel and please like my Instagram and Facebook page. Thank you for watching. We'll meet again.